Let's talk about post-void dribble. So what is post-void dribble? This typically happens when you have gone to use the restroom to pee, you think you're done, or you are done, and so then you wipe, of course, you flush, you pick up your underwear, your pants, or your shorts, you put them back on, you stand up off the toilet, and typically this happens right when you're standing up or you're walking to the sink, and you notice and you feel a few more drops or a dribble come out afterwards. And this can land on your underwear, or if you're wearing a pad or liner, obviously it can be caught by that. But this can often be very frustrating and unsettling for individuals because granted, you thought you were done, and then obviously your bladder was like, oh, just kidding, there's a little bit more left inside that wasn't emptied. So why does post-void dribble happen? This can be due to a couple of different reasons. Sometimes it could just simply be incomplete emptying of the bladder itself. Sometimes there is a lot of tension being held through the pelvis around the urethra that can limit the relaxation and the opening of these muscles so that all of the urine can pass through. Other times it can be due to things such as pelvic organ prolapse. If there is a cystocele, a bladder prolapse involved, or a urethrocoele, which would be a urethral prolapse, or a combination of the two. My point is that these things can just change a little bit of the anatomy, and sometimes urine will just be kind of caught a little bit in a kink, perhaps to say, of the urethra, and just because of positioning, that urine isn't able to fully come out until you are done and you're standing up and you're walking to the sink. So let's talk about strategies on how to stop or at least reduce post-void dribble from happening. First things first, I always recommend to make sure you are sitting on the toilet. So the reason why I recommend this is because if you are in a public restroom or in a restroom that you're not as familiar with, or maybe not quite as comfortable with, you may be tempted to hover or squat over the toilet. That can be tough because what it does is that your pelvic floor muscles have to turn on and engage to support your trunk and your body in that squatted position. But then you're asking them to relax at the same time to pass the urine so that you can go to the bathroom. And this can often be tough for your pelvic floor, and it's not what we want to fully facilitate relaxation. So I always recommend just sit down on the toilet. If you are in a public restroom and you're like, ugh, I really don't want to sit, use toilet seat covers if they're available. You can stack them up on top of each other, 2 to 3, or take plenty of toilet paper and just layer it down onto the toilet seat and sit down and facilitate relaxation that way of your pelvic floor. So with post-void dribble, a big thing that is often seen, sometimes if this happens with moms or just busy individuals, is that individuals will try to power pee or push their pee out or rush the bathroom experience. Understandably so. Sometimes if there's a toddler at the door, or a baby crying, or you are running late for your next work meeting or whatever it is, you are trying to instantly get in and out of the bathroom as quickly as possible. But that is not great for pelvic floor health. We really want to, of course, be balanced and work with ourselves, but at the same time, we want to give ourselves and set ourselves up for the best chance of success as well. So take your time, take some deep breaths in, facilitate some relaxation of your pelvic floor while you are sitting on the toilet. And then with post-void dribble, a big thing that can be really helpful is going through some motions of your pelvis and of your trunk to help empty out any of those last couple drops that may be getting stuck. So things you can think about, a little bit of a forward tilt of your pelvis. So if you're imagining the pelvis here, we're kind of arching our spine, dumping everything forward. So from the side, looks like this, that's a forward tilt. We can also think about tucking the tailbone underneath, kind of rocking that pelvis backwards. That's a backward tilt or a posterior tilt. You can also think about your trunk, leaning your trunk forward, leaning it backwards. This can help put a little bit of extra pressure and change the position of things inside your body so that the bladder helps facilitate a little bit more emptying of the bladder. You can rock side to side. You can do little circles of your trunk, circles the other way. Obviously, this may sound like a lot, but in practice, it really should only take maybe 20 to 30 more seconds. So it really isn't that much longer time, but this can really be helpful to avoid or to get rid of the post-void dribble. Obviously, as you continue your journey through your pelvic health journey overall so that post-void dribble is not a part of your life anymore. So these are just a couple strategies you can implement in the interim. Another big thing that can be very helpful is standing up, doing a few gentle Kegels, so a Kegel and then relax off, Kegel, relax off maybe 3 to 5, sit back down, take a few more deep breaths in, maybe wiggle around a little bit more, and then if nothing else comes out, it's okay. Wipe, flush the toilet, go on your way. But oftentimes these strategies can be super helpful and they can help you get the last few drops out so you're not experiencing that dribble or those few little drops or that little stream, whatever it is, coming out after you feel like you have finished. So try those out and let us know how they go. Take care.